My name is Doreen Randazzo and I'm a women's health coach. First of all, I would like to say congratulations on having a baby. That's such an amazing thing and such a blessing that you have your baby in your arms now. And I would like to tell you how I can help you. As a postnatal coach, I help women do the first initial exercise or breathing or how to engage your pelvic floor again. I also help women if they have any issues afterwards, like if they start to leak, if they have pain with the pelvic floor, might be during sex or during exercises, or that they have a slight prolapse. If you need help with that, I'm here for you. And also I help with women who want to return to exercise or just like safely to restore your core so you're ready for more again. So if you would like any help with that, I'm the right person to ask. Also, I would like to give you some advice today on what you can do right now after you had your baby. So first of all, the first couple weeks, so if you had a vaginal delivery and if you had a C-section, it's a little different, but if you had a vaginal delivery, so the first 6 weeks are really not for losing weight, not for returning back to exercising. And if you had a C-section, even the first 12 weeks, it's really about you bonding with the baby, you giving your body time to heal. So right now, the most important things for you is get as much sleep as possible. So if that's your first child, it might be easier. If it's your second or if you have any more children than that, it might be really hard to get rest, but you should try to get as much rest as possible. Then try to drink a lot of water, because if you don't have enough hydration going on, then it will be really hard for your body to heal. So for healing and to restore the tissues, you need loads of water, and also so your digestion keeps working, okay? So especially after having a baby, the first poop might be really scary. If you had a cut or a tear, it might really hurt. So you want your poop to be as smooth as possible. So really make sure you drink enough. It's very important. So have fiber in your nutrition, so it just digests everything better. Drink enough. Add protein to your meal. So that doesn't mean you have to have meat every meal, but it's like nuts, it's beans, even a lot of vegetables have protein in them. So if you have any question about that, just shoot me a message and I can give you more insight on where you find proteins that aren't meat. So that's the first thing, and then we'll head over to some exercise and some everyday moves that you can do to support your belly better. So my first advice today is sitting down and standing up, something every one of you has to do instantly, okay? So to support your really weak core right now, I mean your core muscles, your belly muscles were stretched for so long. So right now your baby's out and everything feels extremely soft, and it's also extremely soft. So like those muscles need a little bit to adjust again, to go back. So first thing what you can do is every time you get up out of a chair, you want to breathe out. So first of all, you breathe in, and when you breathe out, you come up. So it's a really easy trick to engage your pelvic floor a little bit, to engage your core muscles a little bit, just by breathing out. So that's a really easy thing to do, and I would like you to start doing right straight away. The second thing is, if you had a C-section, your scar will be really painful right now, okay? So to support this, every time you put more pressure into your core, I mean standing up, going to the bathroom, having a bowel movement can really put a lot of pressure on it and might scare you a little bit. So what helps if you use a towel, or this is like a muslin, so if you roll this up, push it on your scar gently, and then when you breathe in, breathe out, just gives that a little bit extra support. And that's the same when you go to the bathroom, you try to put slight pressure on the scar to support it from the outside. So when you have to poop and you want to push a little, it doesn't feel like it's gonna break open. It won't be opening up again. But just to give you that sense of support, it really helps to have this little roll on your scar. So if you go to the bathroom, just use that. When you have to get up or out of bed, you can use that as well. So another everyday life tip is not just for the pregnant or postnatal women, but that's a really good advice for everyone. So even your partners can do that, or your kids. So if you go to the bathroom, you have a bowel movement, pushing out the poop through your pelvic floor is a lot of pressure that goes through your pelvic floor. To make this a little bit easier is if you put your feet up onto a little stool. So it could be any little stool you have in your house. So if you have kids, you probably have some stools in your house anyway. So use those, or you could use 2 loo rolls, or just something to put your feet a little bit higher. And then, do it this way. So your pelvis gets into a little bit different angle, which makes it a lot easier to poop without putting too much pressure to your pelvic floor. So here's my next advice on how to lay down or get up out of bed. So when you sit on your bed, like try to sit on the corner of the bed, put your hands to the side and then lean over to the side and then roll back onto your back if you sleep on your back, okay? And the same way when you wake up and you want to get back up, stand up your knees, you roll them to the side, and then you push yourself over your arms, put your legs down, slide your legs down from the bed, and then get up. And even better is if you combine that with your breath again. So you breathe in, then hold yourself to the side, breathe out, and then lay down. Or again, getting up, legs up, breathe in, roll to the side, and while you breathe out, you push yourself up. Again, if you want to support your scar, and this is a good moment to use that little roll on your scar while you get up, push yourself up with one arm, just to support this a little bit while you put all the pressure through your core. So now we're going to talk about exercises, or you can't really call them exercise, but things you can do for yourself from the first day after having the baby. So if you had a vaginal delivery, it's a little different than when you had a cesarean birth, but it doesn't matter. The first ones I show you, they are for both. So if you have a massage ball, like the little spiky ones, or just like a rather softer, or even a tennis ball, you can use those for self-massaging. So first areas that get really tense after giving birth, or even during pregnancy already, is your neck, shoulders, your chest area. And one reason why we feel so much tension in our neck is because those muscles here in the front get really tight and they pull our shoulders forward, and then we feel it here in the back. So to release this, we need to massage our pectoral muscles or our chest muscles a little bit. So if you just use a ball, you can turn your hand to the outside and then just start applying really light pressure here. So you want to feel some nice pressure, no pain. Okay, we don't want to work with pain. We just want to go gently in there and massage this. So you don't want to go too close to your boobs anyway, especially if you're breastfeeding, or even if you don't breastfeed the first couple days, your boobs might be a little sore. So you really want to go gently on the outside, more around your arm area, and you can go a little bit up. And you can do the same thing on the other side. Also, if you had a C-section or you just feel really weak, obviously you can do this laying down as well. So you lay down, turn your arm to the outside, and then massage those areas. So that's the first one. And the second one is your breath. Okay, so for 9 months you had this big bump now in front of you. So your breathing patterns are a little bit compromised, which we now need to work on. Alright, so what we're going to try to do is put your hands on your rib cage. So like open your fingers, hold it, and then you try to breathe into your fingers and push your hands away. So you breathe in slowly and then release the breath. Deep breath in and release the breath. So you really want to try here not to breathe too much into your belly or too much in your chest. To really use your diaphragm, so into your rib area. sides of your ribs. But also let some air come into your belly and into your pelvic floor, and then breathe out. And then in the first couple of days after you've given birth, everything down here might be a little numb or painful even, feel really uncomfortable, so you probably can't discern your single parts down there yet. So, but you can start to try to imagine, can you feel your urethra, can you feel your rectum, can you feel like anything down there, or just like one numb thing? So, but while you breathe in, you relax, and then while you breathe out, you try, if you can, like feel anything down there, if you can engage anything down there yet. If not, that's okay. But while you do like 10 to 15 of those deep breaths and really slow, you breathe in, relax, and then you breathe out, and then try to imagine where your pelvic floor is, if you can feel it yet, if you can't feel it. You just do this really slow, breathing in, breathing out, okay? If you can't feel anything yet, that's fine. Just work with your breath and work with your imagination and be like, okay, down there, at some point it will feel again. Don't worry about it if you don't yet. It's very, very normal. So just really do the breathing. 10 times in and 10 times really slow out. Okay? If you had a C-section, it's also important to start using your feet, moving your feet. You can do that also if you had a vaginal delivery. So you want to just circle your feet. And the other side as well. So just to start moving, you can slide your heels away. So you want to breathe in when you slide away. Breathe out when you pull back in. Okay, so those exercises are really good for both moms that had a vaginal delivery or a cesarean birth. So you want to breathe in before you slide your leg away, or while you slide your leg away, and then breathe out while you bring it back up. Breathe in. Into your ribs, really let the air come into your ribs, into your belly, and your pelvic floor. If you can feel that yet, if not, that's fine. And then breathe out. Bring it back up. So those are really gentle things you can do just to start reconnecting to your pelvic floor, getting a feeling again, okay? So depending on how your birth was, if you had a tear or a cut, or a cut in your belly, you might feel different or might be numb, or so don't worry about it if you're super early, just a couple days or maybe a couple weeks after you're having your baby, okay? So be really patient with yourself, give yourself time. So I also have a side lying exercise for you, which you can do from the first day after having vaginal birth, or like the 4th day maybe, or see how your scar is. So if it feels uncomfortable laying on your side after you had a cesarean birth, just don't do it yet, okay? Give yourself time, that's totally okay. So if you feel comfortable laying on your side, you breathe in again, like we had before, into your rib cage, belly, pelvic floor, let the air in, and then when you breathe out, you push the hand in front of you into the bed and breathe out. So you don't want to go full power here. So just slightly push your hand down while you breathe out. So breathe in, relax your hand, and then breathe out. Breathe in, big breath into your rib cage, into your belly, into your pelvic floor, and then slow, long breath out. And it's good if you make a noise with your mouth or blow through your pursed lips. You get a long, slow slow breath, okay? Or you can do like a shh. It also helps activating your pelvic floor, okay? So breathe in and then breathe out. And again, you do 10 till 15 of those. You can do them on each side. Yeah, that's a good side laying. Okay, so the last exercise we have is really just breathing on all fours, okay? So you want to breathe in, big breath into your rib cage, and then when you breathe out, slowly release the air through your pursed lips or making a noise like so breathe in into your rib cage, in your belly, in your pelvic floor, and then breathe out, releasing the air. So this exercise is for, you could start this on the first day if you had a vaginal delivery, or on the second day if you had a C-section. Or the first thing is, if you have your ball again, just put it on the floor and then massage your feet. You can hold onto your bed for balance, because your balance might be really off now because your core is weak, so your balance won't be great. Yes, massage the bottom of your feet. Really feel where it's a little bit tender, and if you have some tender spots, you can put some pressure on it and breathe it out until it gets better, and then you keep rolling and you do that with both feet, okay? So that's really easy and feels really nice. So you can do that laying down too from the first day off. If you had a C-section and you're still laying down, you can do that in the bed with your feet, roll them over a ball. It feels really great and gets you moving a little bit, okay? So that's the first thing. And then the second one is you hold onto the bed, you breathe in like I told you before, breathe into your rib cage. And then when you breathe out, you lift onto your toes, okay? You can go really slow, your feet hip width apart, breathe into your ribs, back, front, try to get some air into your belly and your pelvic floor, breathe in, and then breathe out, lift. So if you had a C-section, again, you can use your roll now to put light pressure on your skull while you do this. Breathe in, big breath in, breathe out, lift up. Go really slow, and you do 10 till 15, okay? And you can do that 3 or 4 times a day, just to ease you back in. Okay, so the first 6 till 12 weeks, depending if you had a vaginal delivery or a C-section, are really not about losing weight. They're not about going back into an exercise routine. They're really there for connecting with your baby, reconnecting with your body, okay? Like as I said before, birth can really create some numbness around your belly, your vagina, your pelvic floor area, depending on if you had any injuries while you were giving birth, depending if you had a C-section scar, okay? So be really patient with yourself. This time is not about getting back into fake Instagram figures, because they're usually not real, okay? So loads of those people we might think look like models right after giving birth, they're probably not real, or it's a job, or they have a whole team taking care of their kids and themselves. So that's not what we're looking out for. We're looking out for being real, okay? And being real means it takes a while and your body needs time to heal, okay? So those are the first couple things, really easy things you can do straight after having your baby. And then if you're interested in more, in German there's midwife-led training, so if you have that, that's amazing. If you didn't find a midwife to do midwife-led training with you, you're very welcome to do a similar course with me, which is not covered by health insurance if you have German health insurance, but it's still awesome. And yeah, I offer the 4th trimester course, which is like right for after giving birth, We look at your mental well-being, we look at your nutrition, we look at how to ease you back into movement. Okay, and then following that, I have the C-section recovery program. I have a diastasis program. That means when your belly, the gap doesn't close by itself. And I also have the Every Woman program, which is like for every woman that has given birth, even if you don't have any issues, but also if you have slight issues like leaking, like a prolapse, like lower back pain that just won't go away no matter how long ago you had your baby, okay? Then I can offer those programs for you, and we can work on your personal health and make you feel better about yourself. I'm looking forward to working with you, and